Hola, buenos días. Yo estoy colaborando con una guía de práctica clínica en la Agencia de Evaluación de Tecnologías de Cataluña, en la IACS, desarrollando una guía de esclerosis múltiple con el sistema GRADE. Y mi pregunta era para el doctor Magrini. Thank you for your presentation. As I understand, the black box that you mentioned to go from evidence to recommendations, GRADE tries to make it more clear. But I guess this relies on the physicians anyway, this process of weighing the different factors, 3 or 4, if we use economics. So I wanted to ask, in your experience, how is this working? I mean, are physicians really understanding how they have to do this process, or is it being a little complicated? Because I think this can be useful for us. Thank you.
Thank you for the question. I put 2 examples. One is we used the GRADE because we were in difficulties and stuck with our cancer guidelines. We were discussing with the oncologist of the fact that now drugs are approved even with some of them, at least, for example, in lung cancer, but also in colon cancer, with minimal effects, sometimes weeks or days of benefits. They might have harms, and we wonder why they were approved. And sometimes 5 years ago the discussion was, this is a poorly effective drug. The oncologists were saying, yes, but it's the only thing we have, or could be an additional tool. So we had no dialogue. And also for the drug selection process, sometimes the hospital formularies stopped the drug for a while or said, we want more documentation. So we introduced GRADE, and at least the part on the judgment of the quality of evidence was clear. The evidence is there, sometimes it is minimal, sometimes it is poor, sometimes it is excellent, and we try to go further saying, if it is so good or so bad, the evidence, what do we do? And we try to define some recommendation, and in the past 3 years it has worked well. After 1 year in which the oncologists were afraid that our purpose was to exclude drugs from the hospital formularies, so we made clear that guidelines objective is not to say yes or no to drugs, is to define their proper use. And I think that now it is a good tool. Certainly it depends on who you have in your panel, and sometimes it is different, the discussion, if all panel members are present, or sometimes when a few of them are not there, the discussion is different. Or certainly there is an effect of personality of the people you have in, and their own special interest, or even their own conflict of interest. So if they have published sometimes, when you have to criticize a paper in which your panel member is first or second author, it's very difficult. Sometimes it's also embarrassing. And the second example is when you have a panel at WHO, which is international, it is more used to working with a high standard, everything is much easier. So the lesson from GRADE is, the higher you can work, the better. So it can be good for national guidelines. Certainly it is too much for local